This is the mandible. It is also called lower jaw. This is the human being mandible, the bony structure, and this type of shape mostly it is present in higher vertebrates and human beings. As you are watching that this mandible, it is from top view, it looks like a U shape. From the back side and from the front side, top view, and from the front view, it is just like a lower part of your helmet, and from the back side, it has the middle part, the body, and on either side, these are the ramus. So this is the ramus part of your mandible. So this mandible, the lowermost part, which is the base of the mandible, main body of the mandible, here there is attachment of platysma and deep cervical fascia near the neck region, and on either side the ramus of the mandible, it is flattened from side to side, and it has a coronoid process and it has a condylar process, and in between there is a mandibular notch for mesenteric neurovascular structures passing through it, like that. And inside the relation to the condylar process, there is a pterygoid fossa. Here the attachment of the muscles of mastication, one of the muscle like lateral pterygoid. So anatomical position, the mandible should be it should be placed in the plane surface so that its base passes through the imaginary transverse or horizontal plane. What is the difference between transverse and horizontal plane? Transverse plane, when any plane which intersect the imaginary vertical plane into 90 degree, that will be the transverse plane. And horizontal plane, any plane which is passes parallel from the ground, that will be the transverse plane or horizontal plane. So horizontal plane and transverse plane are the same, but a little bit difference that the transverse plane, one plane which intersect the vertical plane in 90 degree, and the horizontal plane which passes parallel to the ground. So the base of the mandible, it should be touches the horizontal plane, and from the ramus, posterior border of the ramus and the base, there is an angle known as the gonion or mandibular angle here. So during the anatomical position, you should be hold like this simply, so that the base of the mandible should passes imaginary transverse plane. So this is the anatomical position. Let's see some morphological features of the mandible. Here, the upper border of the mandible, lower jaw, it is called alveolar margin, having multiple sockets. You can see the sockets for the articulation of the root of teeth. And always remember, the canine root, it is most deeper as comparison to the other sockets of the teeth. So canine teeth having the deeper roots. And this joint between the root of teeth and the alveolar socket, it forms the gompohosis joint, type of fibrous joint which is non-movable, gompohosis. Here in front of the mandible, you are watching the two foramens, that is the mental foramen on either side, and through this mental foramen the structures are exiting out like the inferior alveolar neurovascular structures, especially inferior alveolar nerve. Okay, and on the lateral aspect, you are watching oblique ridge starting from the anterior margin of the ramus of the mandible till the anterior mid of the just below in relation to the mental foramen, the oblique ridge, that is the mandibular ridge. On either side it is placed like that. And the mid prominence, that is the mental tuberosity. And on outer surface, the ramus from the outer surface, it is almost smooth and having a little bit elevation for the attachment of the muscles of the uh, muscles of mastication, like the masseter muscle, which is almost quadrangular in shape. Again, and from the inner side, what you are watching, the ramus of mandible having a foramen, that is the mandibular foramen. And here the inferior alveolar neurovascular structure enters, these structures enters and they form a fine tunnel like structure, and then they exiting through the mental foramen. So inside, the inferior alveolar canal is connecting from the mandibular foramen in the mid of the body inside it until the mental foramen. Okay, and just near to the mandible foramen, a small tongue-like projection. This is called lingula, where the stylomandibular ligament is attached. And this is the inner surface of your ramus of mandible. Here, for the attachment of like medial pterygoid muscles. On the anterior margin of the ramus of the mandible, here almost near the tip and anterior margin for the temporalis muscle attachment. And near the angle of the mandible, here the uh, angle is known as gonian, angle of mandible, and it forms almost 140 in means more angle in children's and in old person, but in adults, young person, it is a little bit smaller. Ratio is about 110 to 120. So there is a age changes in mandible. Small difference. I have told you by mistakenly that here on the lingula there is a sphenomandibular ligament, and near the angle of the mandible for the stylomandibular ligament. Here in the inner surface of the mandible, you are watching just in the middle the four small fine tubercles. These are the genial tubercles, upper pair of genial tubercles and lower pair of genial tubercles. Upper pair for the attachment of the genioglossus, the bulkiest muscle of the tongue, and lower pair of genial tubercle for the attachment of geniohyoid muscle. They are very small, but the muscles are enlarged in size. And from the inner surface of on either side of the body of the mandible, again you are watching the oblique ridge, that is the mylohyoid ridge for the attachment of the mylohyoid muscle, which form the mantle diaphragm. And above this a small triangular area, and below this again a small triangular area above this for the sublingual fossa, for the sublingual gland, and lower smaller area is called submandibular fossa for the submandibular gland. So the ossification of the mandible means its development during the intrauterine life. As you are watching that the main body, it has two halves, right and left halves, and the ramus with condylar and the coronoid process. So the primary ossification center appears during the intrauterine life. A single primary ossification center just in the center of the each half of the body. And the secondary ossification centers, they appear like in condylar process, the coronoid process, and the mental tuberance also. And they appear just after the birth. That is why it is called secondary ossification centers. And all these ossification centers, they reunite and means totally ossification, proper formation of the mandible occurs when the child get reached its first year of the life, like 1 year. So during the 1 year, each bony part of the mandible almost form, proper ossification is occurs. Now we will see the clinical significance like age changes in mandible. Means how it looks like in kids, how it looks like in adult, and how it looks like in old age person. So on the basis of mental foramen position, we can differentiate. Like during the childhood, the location of the mental foramen, it is almost near the base of the mandible here. So in the kids, it will be near the base. In the adult person, it is almost in the mid position of the main body of the mandible. So in this bone, this is in the mid position. It means it is the mandible of any adult person. And when this mandibular foramen position, it reaches almost near to the alveolar margin here. So that will be present in the old ages person. And we can see in old ages, most of the sensitivity condition appears due to the exposure of inferior neuroalveolar vascular structure, especially inferior alveolar nerve, and cause the sensitivity. Other cause that the this changes in position of the mental foramen from base to mid then to the upper border. It is due to the bony resorption process, like the newer cells form the lower base side, then again newer form, the older one disposes towards the mid, and then middle one, and they disposes the old cell layer toward the alveolar margin, and like this the bony resorption process going on. And time to time we can see the mental foramen position from base to mid to alveolar margin, it appears. So that is the 8 changes in mandible, and it is very important from the examination point of view You should remember all this. Till further, you can like and subscribe the channel so that upcoming videos or any information regarding this or any bone or any part of the research you can teach and learn and discuss with me. Till see you and bye bye. Take care. Thank you. So this is all about the mandible of human being, and when these articulate with the skull through the condylar process, it form the temporomandibular joint, and I will teach you in regarding this TMJ in the next session.